A chronic disease is a medical condition that is prolonged, with treatments that may take months, years, or can be lifelong. Asthma, cystic fibrosis, obesity complications, diabetes, and ADHD are among the chronic diseases affecting children. We went to CHOC Children's Hospital and spoke to Dr. Mery Taylor about these children and the families coping with chronic disease.
Because of the advances of medical technologies, we have children who have medical conditions that in the past they might have died from or have needed lifelong intensive treatment. So the conversation has changed from something very tragic to now what's important is the quality of life of this child who now has a chronic medical condition. A child with a chronic medical condition can mean an infant, it can mean a toddler, it can be a school-aged child, and it can be an adolescent. They are more at risk for having other mental health problems or adjustment problems, such as depression, anxiety, and behavioral problems. Kids need some time to be able to process information, particularly medical information that may be new or complex. And so it's important to sort of let them lead the discussion, and then the parents can just add little bits and pieces of information as they need to. It's important for the child to participate in family life, do things with their friends, and particularly go to school. So what's really key is having a sense of normalcy. The relationship between the child and their medical condition is going to change over time. And parents need to adjust how they respond to their child depending on their developmental age. You need to develop a relationship with the child, and that starts with using their language, and their language is play. So you want to color with them, you want to play a game with them before you start to teach them all these great skills that we have that supposedly is going to make their life so much better. We have to start with building that relationship, and over time then we can progress to giving them some skills of how to deal with their anxiety for their next procedure.
Dr. Taylor discusses breathing techniques and other coping strategies.
If I want to teach him how to do breathing, again, I try to make it relatable. I try to get into what is a kid's world. So I will take out bubbles. I will take out pinwheels. We talk about it as belly breathing. So we're going to fill up our tummies with air, and then we're going to make it a nice big, bouncy ball, and then we're going to deflate that ball. So images that the child is familiar with, and activities that the child is familiar with that are fun and kid-like. The tricky part comes with adolescence, and adolescence is already complicated enough as it is, and then you add a chronic medical condition to it. But having an open communication with their teen and trying to help them to figure out, well, how can we stay within the medical parameters and still have you participate in all the activities that you want with your friends is important. And I think there is a tendency to want to overprotect, to give a ton of gifts, but as much as possible try to set limits for these kids. And if they're going to earn something, make it because they behaved while they had a blood draw and they didn't throw something at the nurse or something like that, so that it's something that's earned, but not that they just regularly get things just because they're sick. The adolescent doesn't necessarily feel sick, and it's that damage that they're doing to their bodies over time, and at that moment they may not recognize the impact that not taking their insulin may have on them, but it's critical, but it can be done. It's just a matter of communicating, it's a matter of problem solving, and figuring out how they can do the things that they want to do, but also be in compliance with their medical regimen.
Chronic disease among children is on the rise in our country, so medical treatment as well as social support is important for the child and their family. For the American Health Journal, I'm Laura Windsor.